Welcome to today's webinar, Maintaining Your Best Nutritional Status, an American Association of Kidney Patients HealthLine Innovator webinar sponsored by Pentec Health. My name is Erin Kale, and I am Director of Patient Insights, Data Analytics, and Advocacy for AAKP. I oversee our patient education and grassroots engagement activities, including our Ambassador Initiative, which comprises highly motivated and engaged patients, living donors, and caregivers around the country and the globe. These individuals have a direct connection to kidney disease and have committed to raising awareness and providing support to others navigating the challenge of this chronic disease. You will hear from one of our ambassadors, AAKP HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives. We built the center with the latest polling and engagement technologies to ensure that kidney patients take a central role in informing the federal, academic, and private sector research shaping the next generation of healthcare services, assistance programs, and innovative new treatments. AAKP is pleased to launch our Innovator webinar series, an extension of our normal HealthLine webinar programming. As the oldest and largest patient-led kidney patient organization in the U.S., AAKP is proud to host this Innovator webinar as a service to the expanding national and global communities of patient consumers and their families, medical practitioners, researchers, and policymakers following innovation and advancements in kidney care and treatment. AAKP is an aggressive supporter of innovation to change status quo care. While this activity is an approved educational webinar, AAKP does not endorse this webinar nor endorse or promote any specific commercial entities or products. The content of this program as presented and financial support of this webinar was provided by Pentec Health. Before we get into this presentation, I would like to take the opportunity to introduce Eileen Moore, the creator of Proplete IDPN. Eileen is currently Clinical Liaison Director for Renal Products for Pentec Health located in Glen Mills, Pennsylvania. She has over 30 years total clinical combined renal nutrition and nutrition support experience. She is recognized for her specialty in renal malnutrition and has been an invited speaker at numerous conferences. She has also published in peer-reviewed journals on subjects related to renal malnutrition. Eileen, I turn it over to you.
Thank you so much, Erin, and welcome to our audience today. Just wanted to give a short background on Pentec Health. Back in 1983, Pentec Infusions began really as a small regional pharmacy that met the needs of dialysis patients and patients with severe pain or spasticity. Over the years, the company expanded into a leading provider in both of those industries. And in 2006, Pentec Infusions was renamed Pentec Health to better reflect their leadership as a diverse healthcare company. As a provider of renal nutrition therapy, Pentec Health has served thousands of dialysis patients who have had trouble maintaining optimum nutrition status by our provision of Proplete IDPN for hemodialysis patients and IPN for peritoneal dialysis patients. You will be learning more about these therapies in today's presentation. Thank you, Erin.
Thank you so much, Eileen. I'd now like to introduce the next two speakers. Annmarie Duggan is Pentec Health's Clinical Education Specialist. She has over 35 years of clinical nutrition experience, including the last 27 years working as a renal dietitian, caring for both in-center and home dialysis patients. Her career has included experience as a nutrition support dietitian, adjunct professor, dietetic intern, preceptor, and research coordinator. She is currently the clinical education specialist for Pentec Health. And Nina Rucosky has over 28 years as a registered dietitian, including 15 years in nutrition support and 9 years as a renal dietitian. Yes, she is currently a renal clinical case manager with Pentec Health and is responsible for supporting both dialysis clinic staff and patients to achieve their nutritional goals with Proplete IDPN and IPN therapies. Annie and I turn things over to you. And when you get to the slides with the videos, I will manage those on the back end for you.
Hey, excellent. Thank you so much, Erin. And welcome everyone to today's webinar, Maintaining Your Best Nutritional Status. Okay, everyone, so before we get started, just to let everyone know, the speakers are employed by Pentec Health, and the views and the opinions expressed in the following PowerPoint slides are those of the individual presenters and should not be attributed to the American Association of Kidney Patients, its directors, officers, employees, volunteers, or members. And for today's topics, we're going to discuss first, what is a good nutritional status? And how does chronic kidney disease and dialysis affect nutritional status? We're then going to review what is malnutrition and protein energy wasting. And then we're going to discuss how people with kidney disease can take an active role in preventing and treating protein energy wasting. And then we'll conclude with what therapies are available to treat protein energy wasting in chronic kidney disease. So let's start by looking at what is considered a good nutritional status. A good nutritional status is when your body is getting the energy and nutrients it needs, and you're able to digest, absorb, and use those nutrients to support body functions, maintain your health, and carry out your everyday activities. But how does kidney disease and dialysis affect your nutrition status? Well, many times people with kidney disease experience symptoms that interfere with their food intake. How has your appetite been? A fair or poor appetite may result in not eating enough to maintain your strength and nutrition status. Do you sometimes feel too tired to prepare your meals? Or maybe you feel your renal diet is too limiting and you might be unsure what you can eat, so you end up eating less. How is your stomach and your digestion? Sometimes people with kidney disease may experience nausea, upset stomach, or even constipation and diarrhea. This can interfere with how your foods and nutrients are absorbed and utilized in your body. You may not realize it, but if you're on dialysis, you lose protein and amino acids, which are the building blocks of protein, every single treatment. And if you're not able to eat enough protein to replace what you lose, your body takes it from your muscle stores, and that can cause you to lose muscle strength and feel weaker. So what is malnutrition? Malnutrition is a term used when you have a poor nutritional status, and it's defined as the lack of proper nutrition caused by not having enough to eat, not eating enough of the right things, or being unable to use the food that you do eat. And this can happen in cases of starvation, but it can also happen in illness or disease like chronic kidney disease. So what is meant by the term protein energy wasting? This might be a new term that you haven't heard of before, but protein energy wasting, or PEW, is a term used for malnutrition in people who have chronic kidney disease. And it occurs when you have lost body stores of protein and energy, and it could result in having difficulties doing your daily activities. And it can occur in people of any weight, even if you're overweight. This type of malnutrition is more common than you might think. And studies have found different ranges due to the variation in the parameters they use to define what protein energy wasting is. So based on which criteria are used, up to 54% of people on hemodialysis could have protein energy wasting, up to 49% of people on peritoneal dialysis, and even people who've had a kidney transplant can experience protein energy wasting. So how does protein energy wasting affect your health? Well, protein energy wasting can lead to a loss of muscle stores. So this can reduce your energy and even interfere with your physical function. So you might find it more difficult to get out of your chair or to do your chores and housework or have the energy to participate in family activities. And I think today it's even more important to have a very strong immune system. And protein energy wasting can lower your immune function, making it harder to fight infections. It can even reduce your ability to heal from wounds or surgeries. People with protein energy wasting also end up having more hospitalizations. So how do you know if you have protein energy wasting or if you are at risk? So you can take this short quiz, and protein energy wasting is diagnosed if you have 3 of these characteristics. So number 1 is to look at what your albumin level is. And if you are on dialysis, you usually will get a copy of your blood work each month, and it does contain your albumin level. So levels less than 3.8 are considered low. Have you lost weight without trying? Or are you having trouble with your strength or energy level? That could indicate reduced muscle loss. And has your appetite been poor? Have you been eating less than you normally would eat? So how can you take an active role in preventing or improving protein energy wasting? Well, first of all, speak with your dietitian, your nurse, or your kidney doctor if you have a poor appetite, or if you're losing weight without trying, or if you have any symptom that interferes with your eating. Keep track of your weights, particularly your post-dialysis weight if you're on dialysis. Know what your albumin levels are. I know we said less than 3.8 is considered low, but the healthiest level is 4 or greater. And discuss levels that are less than 4 with your dietitian or your kidney doctor. If you are admitted to the hospital for any reason, make sure you request to see the hospital dietitian if your appetite is poor. And ask for nutrition supplements if you're not able to finish the food on your tray. Once you return back to your dialysis clinic after a hospitalization, make sure you ask to see your clinic dietitian to discuss how you can improve your nutrition status to support your recovery. So what if you're not able to eat enough to meet your calorie and your protein needs? These are different strategies or tips. One could be to try smaller, more frequent meals and healthy snacks. Sometimes it's overwhelming to see so much food on a plate at once, and it helps to try smaller meals and then have some healthy snacks in between. You can also try to save your fluid for after meals to save your appetite for your food. If you're the person who is cooking and preparing meals for yourself, sometimes it helps to cook ahead and cook on the days or the times of the day when your energy level is the highest. And then you can freeze leftovers to have on hand for quick and easy meals. To add more flavor and perk up your appetite, sometimes adding some different herbs and spices helps. And also planning to eat at the times of the day when your appetite is best. Some people might have a better appetite in the morning. Other people might find their good meal of the day is lunchtime. So really take advantage of those times when you have the best appetite. And if you're still not really eating enough in terms of food, you can also try oral nutrition supplements. And they can come as commercial drinks or protein bars. And your dietitian can guide you as to which product would be best based on your individual needs. And you can even make a homemade kidney-friendly smoothie. You can ask your dietitian which protein powder is best for you, and you can use a scoop of protein powder with a non-dairy milk, almond milk as an example, and a cup of frozen berries, and blend that and have a kidney-friendly smoothie with protein as a snack. So what if you're still unable to meet your nutritional needs with food and supplement, or if your nutritional status worsens? Nutrition can be provided as part of your dialysis treatment. Intradialytic parenteral nutrition, or IDPN, is nutrition given during hemodialysis. If you're someone who's on peritoneal dialysis, intraperitoneal nutrition, or IPN, is nutrition given during peritoneal dialysis. And the goal of these therapies is to help improve your appetite, improve your strength and energy so that you can feel your best. So I'm going to turn it over now to Nina, who's going to give you a little bit more information about IDPN and IPN nutrition therapies.
Thank you, Annmarie. So now we are going to look closer at IDPN and specifically Proplete that is infused during your dialysis treatment. What is Proplete IDPN? Proplete is a solution infused during your dialysis treatment. It consists of amino acids and dextrose. IDPN solutions in the past had tolerance issues. However, Proplete is unique, made with a small amount of dextrose. Since 2008, we have found that Proplete has been well tolerated and our patients respond very well to Proplete. Pentec Health's Proplete IDPN is based on your body weight and dialysis treatment time. We also have different formulations and options with additional calories that can meet your specific needs. How do you know if you need Proplete IDPN? Talk with your dietitian and healthcare team. They have access to your medical records, your albumin, and other lab work. They can assess if your protein and calorie intake is adequate and if you have had any weight changes. Again, Proplete is unique because of its low content of dextrose. Wow, this is wonderful if you are diabetic. It helps prevent issues with high blood sugar while helping you improve your nutrition status. What is in the two types of Proplete IDPN? The left-hand side of the coffee cup represents our standard Proplete. Proplete formulations are unique and are the newest and most widely used IDPN in the United States. The design is very low dextrose with amino acids and no lipid or fat. The amino acids are a very important part of IDPN. They replace losses during dialysis that can affect appetite and allow the body to build new proteins. The right-hand side of the cup represents our Proplete Plus. Proplete Plus formulations are reserved for those patients who may require additional calories. How will you receive the Proplete IDPN? Proplete is great. It is given during your dialysis treatment and does not require you to have another IV. It infuses into the dialysis machine. Your dialysis treatment will not be longer while receiving Proplete. Isn't that fantastic? How long will you receive Proplete? Everyone is different. You may receive it for a few months or longer. You may notice you feel better after a few months, have more energy, allowing you to do the things you enjoy. We have had patients who were able to continue working, golfing, playing with their children and grandchildren. What if you were doing hemodialysis at home? Can you still receive Proplete IDPN? Yes. Proplete IDPN can be given at home during your home hemodialysis session. Let's hear from our clinical director, Eileen Moore, and one of our patients, Cheryl, who shares her experience on Proplete.
Hello, my name is Eileen Moore. I'm the Clinical Liaison Director for Renal Products at Pentec Health. As a clinician, I had many patients who did not respond adequately to the standard malnutrition treatment approaches of liberalized diet and oral nutrition supplements. For these patients, malnutrition became a significant problem, requiring treatment with parenteral nutrition, or IDPN, intradialytic parenteral nutrition, which is infused during the dialysis treatment. I witnessed firsthand the problems patients experienced with traditional IDPN, prompting a strong desire to try to find possible solutions. This led me to create a new, better tolerated solution, otherwise known as Proplete. Since then, Pentec Health has treated thousands of dialysis patients with the low dextrose, low volume, high protein formulations of Proplete. We've interviewed a few of our patients to show just how great an impact parenteral nutrition therapy has had on their lives. With the help of our treatments, they've been able to maintain proper nutrition status, leading to a higher quality of life. Let's take a look at one of those patient stories now. You can view the rest at www.proplete.com, What Matters Most. Thank you.
My name is Cheryl, and I am from New Brunswick, New Jersey. I love to read. I love to cook. I'm a collector of clowns. Anything dealing with the carnival. I love carousels, music boxes. I love animals. I have 2 birds, they're finches. One is named Snowy, and the other one is named Little Pete. I started dialysis in 2000. I was on dialysis until 2007 when I got a kidney. The kidney worked for 10 years until 2017, and I had to start dialysis again April 3rd. So I have been on dialysis now for about 2 years or some months. While I was on dialysis, I got very depressed, and I could not eat, and I began to lose weight. Then I got sick even more with my heart and lungs depleting, and I wound up in the hospital for another 3 or 4 months, and I lost weight again. And then when I did come home, I fell, fractured my pelvic bone 3 places, and I lost weight again. By the time I got home, I was 65 pounds. When I started the IDPN, it took a while for my body to react. I started off eating a lot of oatmeal and cream of wheat, and then all of a sudden I started to crave English muffins. I ate like a pack of those a day. Then the next thing I know, I started with the meats. So I wanted subs and lunch meats and things, and the next thing I know, I'm ordering lasagnas and pizzas and spaghettis, but it took time, and I was working so hard to gain weight. My sisters, they felt like once I weighed 100 pounds, they would give me a 100-pound party, and that's what they did. When I reached my goal of 100 pounds, we went to a Japanese Chinese buffet, and it just felt so wonderful. I do believe I can keep the weight on. As a matter of fact, each time I go to the doctor, he has to raise what we call your dry weight. Before I started the IDPN, I slept all the time. I was on oxygen, and I was so weak that I couldn't climb up and down the stairs. I couldn't do anything. If it wasn't for the IDPN, I'd probably still be at home needing a caregiver. It really does build you up, and it builds up your desire for food. And that also helps wanting to do things. So I would recommend it.
So now we are going to move on and discuss if you are a peritoneal dialysis patient. Can you receive Proplete 2? Great news, the answer is yes. Next slide. What is Proplete IPN? Proplete IPN is a nutrition for peritoneal dialysis patients. It provides protein your body needs to keep you strong and active, allowing you to continue to do all of the activities you enjoy. If you are on a cycler or a patient using manual exchanges, we can provide you with Proplete IPN. Next slide. How will you receive Proplete IPN? IPN usually replaces one of your exchange bags. If you are using 3 bags, you will continue to use 3 bags. The only difference is one will be Proplete IPN. The number of bags you use will not change. Another benefit of IPN is you will receive it weekly, greatly reducing the PD solution boxes you are currently storing in your home. Next slide. Proplete IPN can be used with or without a cycler. Again, as we mentioned earlier, you can use Proplete IPN whether you are on a cycler or are using manual exchanges. Next slide. Will you need to learn something new? We use the same bags and connections that you are using now. No need to learn something new. If you are a cycler patient using Baxter Ambuflex bags, you will receive your IPN in that same Baxter Ambuflex bag. If you are using Fresenius Delflex bags, your IPN will be in that same Fresenius Delflex bag. This holds true for manual patients as well. If you are using Fresenius Stay Safe bags, you will receive your IPN in a Fresenius Stay Safe bag. and manual patients using Baxter Ultra bags receive their IPN in a Baxter Ultra bag. This is fantastic because there is nothing new to learn. Next slide. How will you receive Proplete IPN bags? You will receive your Proplete IPN bags in a weekly shipment to your home. We provide you with a small refrigerator to store your bags. Pentec Health has a nurse available who will guide you, your caregivers, and healthcare team through this easy process. You will be meeting our awesome nurses, Stephanie and Deborah, at the end of the presentation, who can answer any questions you may have regarding Proplete at home, whether on home hemodialysis or peritoneal dialysis. Next slide. What clinical support will you have? You will have a dedicated and experienced dietitian who will work with your clinic dietitian and treatment team, a dedicated and experienced pharmacist who is available on call 24/7, a reimbursement team with over 36 years of experience. Next slide. What support will you have if you are a home dialysis patient? You will have an experienced and dedicated nurse who can answer any questions, provide education, and will work closely with your healthcare team. Stephanie and Deborah are wonderful, very knowledgeable, and always available to provide you with support and answer any questions you may have. You will get to meet them and ask any questions at the end of the program. Next slide. Can anyone get Proplete IDPN or IPN? Coverage varies depending on your insurance. And remember, our reimbursement team is always here to help. Now let's hear from another one of our patients, Neil, while he shares his experience with both Proplete IPN and Proplete IDPN.
I love riding a bike, and that is my hobby, my passion. It just gives me a sense of freedom. There's just something about being one with nature and being outdoors. I go out and I ride probably twice a week. Previously, I rode anywhere from 4 to 5 days a week. The thing that changed the frequency was being diagnosed with ESRD, end-stage renal disease. When I first got my diagnosis, I was in denial. And I thought that I could beat this, eat right and continue to exercise. And I continued to ride. But I wasn't receiving any type of treatment. So obviously my health started to decline. And I was really concerned then and stopped riding because I felt sick most of the time. People may not know that with each exchange through PD, you lose protein. So that was something that I wasn't aware of. I'm not a big meat eater, so not a lot of protein. Can't eat a lot of beans, they're high in phosphorus. So because I didn't eat a lot of meat, I slowly started losing weight, just didn't have as much energy, and it really affected me. At the point that the numbers weren't good, they decided to incorporate protein bags, or the IPN. So I would receive those weekly and incorporate them into my treatment plan. Being on PD, took a trip and ended up being in a hotel room and somehow just not the cleanliest of environments, and ended up getting an infection. And at that point, I ended up doing hemodialysis. It caused me to change my modality of treatment, and I just started feeling better. I got stronger, and while I was receiving hemodialysis, I also was receiving the protein through the IDPN bags, and it was amazing how fast my numbers shot up. I went from being like a 1.8 to 4.0 in a very, very short period of time. So I felt an immediate change. I felt stronger. I could feel my energy coming back. I felt so much better. And that's where we're at today, pretty much. So I've been on hemodialysis going on close to a year, and it's made a huge difference. The scheduling is nothing I can do. You got to go 3 times a week, but it really works for me, and I'm able to get on the bike a couple more times than I had been. A day like today, I'd probably go out and get about 20 miles in. Anyone who has a low protein count, I would definitely recommend that they would inquire about IDPN if they're on hemo and IPN if they're doing peritoneal dialysis. The protein, along with the treatment, has definitely improved my quality of life.
What do we want you to take away from this session? We want you to take an active role in monitoring your nutritional status, identify the signs and symptoms of protein, energy, and wasting, and communicate any nutritional changes to your healthcare provider. Proplete IDPN and Proplete IPN are great options to improve your nutrition status. Now let's go to our panel. Eileen Moore, our clinical director. We also have our nurses, Stephanie Paul and Deborah Degree here with us today to help answer any questions you may have.
Thank you so much, Annmarie and Nina. We would now like to introduce Deborah Degree and Stephanie Paul. Deborah Degree serves as Renal Clinical Educator at PenTech Health. Her role includes speaking to colleagues at various conferences and providing patient education and hands-on training to patients, their families, and home dialysis nurses. Deborah completed her BSN in nursing at University of Alabama. She has been a nurse for over 30 years, serving in the renal community since 1990. Currently, she is the president for the ANNA Dogwood chapter in the greater Atlanta, Georgia area. And Stephanie Paul serves as renal clinical educator with PenTech Health and is responsible for educating patients and clinicians regarding IPN. Stephanie has over 13 years of nursing experience, including working as a renal clinical support nurse and providing education for in-center, peritoneal, and home hemodialysis patients and clinicians. Her career has also included working as a renal, hepatic, and islet cell transplant nurse and as an acute hemodialysis nurse. We will begin the session by addressing some of the questions that we received via email in advance of this webinar. So the first question here is, what resources are available when you don't have access to a renal dietitian?
Hey, Erin, I'll answer that one for everyone. There are a variety of resources that are available on the AAKP website. You can click on the kidney-friendly recipe link, and there's links to a variety of websites that have nutrition information as well as recipes that you can try. You can also visit the National Kidney Foundation website at kidney.org, and if you click Kidney Basics and scroll down to the diet and nutrition section, there's information on different stages of kidney disease, how to use spices, and a plant-based diet guidelines section. There's also a link on how to find a renal dietitian. And if you have Medicare with a physician referral, your consult might be covered if you see a Medicare dietitian provider. Or it might even be covered by your private insurance plan if this dietitian is on your insurance plan and it's approved. But it's a very individual situation. We also received many questions prior to the webinar via email about stage 4 kidney disease and nutrition. And this is a stage when your diet is very individualized based on your kidney function. So this is a stage when it's definitely very helpful to work with an experienced renal dietitian so that you can feel your best.
Thank you, Annmarie. And I have another question for you. How can someone add more protein to their diet if they don't like meat?
Okay, so that's an excellent question because there are many non-meat plant-based sources of protein that are very kidney friendly. So trying things like tofu or nut butters, lentils and beans. There's a lot of meat substitutes on the market now, although it's important to read the labels because some of these could be high in sodium. You can visit that plant-based section of kidney.org for different ideas and recipes. And there's also a variety of protein bars and oral nutrition supplements. But again, they can vary in nutrition content in terms of potassium and protein and calories. So it's best to ask your dietitian for recommendations. And your dietitian can also help you to choose which foods are best for you to maintain your nutrition status and your kidney health.
Thank you so much, Annmarie. And now I'll turn these questions over to the rest of the panel, and please jump in as you feel you can address them. So we have a question from an attendee who says that their problem is feeling hungry and feeling like they need to eat more than they should. How do they control their hunger and urges to eat and eat too much?
Nina, would you like to answer that?
Yeah, okay. So that would be very individualized to the patient, Erin. I would suggest that they reach out to a dietitian in their area for more extensive counseling. That wouldn't be something that we would be able to address here on the panel.
Great, thank you, Nina. Some other questions that we have received. When can someone expect to see results once they start receiving Proplete?
I'll take that one. So we see results within approximately a few months. Most patients start to see their albumin and their lab work start to improve. They also start to experience an increase in appetite. They start feeling more energetic, start feeling better. So we see improvements in most of our patients in a couple months.
Thank you. We have another attendee who says they dialyze at home. Are there any side effects or tolerance issues they need to be aware of while receiving Proplete?
Erin, I will take that question. Basically, I think when Nina and Eileen talked about the Proplete, one of the things that we actually see with our patients is very little tolerance that they have because the formulations are individualized to each one of the patients. And if they do have any tolerance issues, then as they talked before, we have myself and Stephanie as nurses, we have Nina, our renal clinical care managers, and also our pharmacists that if they start having any tolerance issues at all, we like to address those as soon as we can, because what I try to explain to the patients as we're doing the training is that this is an individualized prescription for them. And like any prescription, sometimes that formulation might not fit them initially. They may have some issues such as nausea, maybe diarrhea. And as soon as they let us know that, we can actually, what I call tweak the prescription. So if they do have tolerance issues, then what we would ask them to do is let us know that as soon as possible. So if we need to change it, we can actually do that, because what we want to see is the patient get the benefits that you heard about throughout the presentation of receiving the Proplete without having any tolerance issues.
Thank you so much, Deb. Another question came in. What are the signs and symptoms of protein wasting?
Is Annmarie still on? Some of the signs and symptoms of protein wasting. No, did you want to take that, Annmarie, or do you want me to take that?
Oh, you can go ahead, Nina.
Okay.
Yes,
So some of the symptoms, you might just start to feel weak. You might just start notice that bony prominences. You might start to see that you're not that sunken in type appearance. Sometimes people will notice loss of fat stores in their face and their cheeks. Strength, not being able to lift things that they were maybe able to lift and do before, like laundry baskets. Maybe it's harder for them to carry the laundry or things downstairs. And they may attribute those to maybe being getting older or pass them aside. And a lot of times they are related to inadequate intake of protein and calories.
Thank you, Nina. Are there any other signs or symptoms to look out regarding lab results and things that perhaps the dialysis nurse or somebody in the unit would recognize?
Yes, so we, when your care team dietitian, you're at the dialysis clinic or at your nephrologist office, they will run a panel and they can look at your albumin, which is a good marker of your nutrition status. They start to see that level decrease. That's a sign that you're not eating adequate protein or calories. There are also markers we call BUN. That is another marker we can look at. And we can look at another marker called NPCR, which also tells us if you're eating enough protein on a daily basis. So it gives us real-time answers on how someone is eating.
Thank you so much, Nina.
Sure.
I have a couple of questions here for Stephanie. The first one is, this person is on peritoneal dialysis at home, and they're wondering if they will have to inject the protein into the bag.
Good question. No, you won't have to inject any protein into the bags. The protein bags or the Proplete bags that we send you will have the protein already injected inside. So there's nothing extra or that you would have to do with these bags.
Thank you, Stephanie. And can you talk again about how the bags are delivered, and will this person need any new connections for their catheter or any other things that they need to be aware of?
So to answer your first question, we would supply the bags or deliver the bags by way of FedEx weekly. We give up patients a couple of options. They can receive however many bags for their treatments in one day, or if they would like to split a delivery, we can accommodate them that way as well. If patients have issues with strength, disabilities, things like that, we might be able to help them out by using a courier service if we have one that services their area. As far as connections are concerned, we went over it in the presentation, and we did talk about how you don't have to do anything different, add anything different. These are the same exact bags that you're currently using. We have a warehouse full of different sizes, Baxter, Fresenius products. We can accommodate you in whatever size bag you need. And again, you don't have to connect anything different. You'll use your transfer set or your stay safe sets that you currently have attached to your catheters.
Great, thank you, Stephanie.
We want to make this as easy as possible for you, so we don't add or anything that we don't need to.
Thank you. And I have a final question here for Eileen. What were some of the problems with IDPN before Proplete came about, and how did Proplete solve these problems?
Thank you, Erin, for the question. The traditional or older formulations of IDPN contained high amounts of dextrose or sugars. So one of the very common problems was hyperglycemia, high blood glucose. Oftentimes, even in non-diabetic patients, that required the use of insulin. As a result of the use of insulin, then, one had to be concerned about the possibility of the patient experiencing low blood glucose after the therapy stopped. So that was a major concern. The other most common problem was volume. Pentec uses the most concentrated sources of amino acids and dextrose in our Proplete formulations. And also because they are lower in dextrose and we use concentrated solutions, the volume has decreased considerably. They are also weight-based, which helps really target the volume total to the patient's body weight more appropriately. So those two primary concerns were eliminated with the Proplete IDPN, which has been very well received and well tolerated since we launched it back in 2008.
Thank you so much, Eileen, and thank you to our panel for responding to all of these questions. If there's a question that we did not get to today during the presentation, you can email us at info@aakp.org, and we will work with today's speakers to get a response to you.
Erin, thank you so much for
Thank
advancing
you.
the slide. Yeah.
Thank
Nina?
you. Yes, we want to thank you for participating in our program. Please make note of the phone number on your screen. We have a registered dietitian experienced with Proplete that can help answer questions you may have related to Proplete therapies. Please visit our website, www.proplete.com, to view more educational videos and patient stories like Cheryl and Neil's. Thank you again for attending our program today.
Thank you so much, and thank you again to today's speakers, Eileen, Annmarie, Nina, Deborah, and Stephanie. I'd like to now close with some additional resources from the American Association of Kidney Patients. If you are not already a member of AAKP, we encourage you to join us. We offer free membership to patients and their family members, as well as living kidney donors. You can become a free member by joining online or by phone. And in order to receive all of the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 different electronic newsletters and subscribe to our print magazine, AAKP Renal Life. We also invite you to follow us on our blog and social media for all the latest news and announcements. AAKP is dedicated to helping patients understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers. You can order these through our website or over the phone, and you can also download copies for free. We also offer numerous kidney-friendly recipes with details on the nutritional content and which stage of kidney disease these recipes are good for. By visiting our website at aakp.org and clicking on the AAKP store button at the top of the homepage, you can find these brochures and tools to order or download. We'd again like to thank Pentec Health for sponsoring this AAKP HealthLine Innovator webinar. Thank you all for joining us today. Be informed and stay safe.